Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting the press conference in Spanish. His interpretation will also be available on the county's website and YouTube page shortly after we conclude this press conference. Governor Newsom did not announce any new details today on his plan to reopen a limited number of businesses in California this Friday. As of today, the only new businesses the governor has authorized to open Friday are what he identified earlier in the week as low-risk retail businesses, and only for curbside pickup. The examples the governor listed on Monday include clothing stores, bookstores, music, toys, sporting goods, and florists. Importantly, Governor Newsom also authorized reopening the manufacturing facilities for these retail businesses. Reopening the supply chain for business is critical to their success because many stores won't be able to open and certainly stay open if they can't get new inventory. The governor has not yet modified his statewide stay-at-home executive order or authorized any other businesses to open beyond this limited group. The governor has also not yet authorized counties or other local governments to modify his stay-at-home order. If you have any questions about this, please call the county's call center line at 833-688-5551. There will be live operators available to answer your questions. Yesterday at the Board of Supervisors meeting, Dr. Do Reynoso outlined the early preparation and ongoing hard work her team at the County Public Health Department is doing to position us to address the new guidelines the governor plans to announce as early as tomorrow. Governor Newsom has said these new guidelines will direct the state's next steps forward in the phased reopening of additional new businesses in California. The County of Santa Barbara is continuing to move forward to be ready in anticipation of the governor authorizing the opening of more businesses. But at this time, we continue to be limited under the governor's executive order. We must all remain patient, diligent, and committed in our combined work to slow the spread of the virus. The numbers in Santa Barbara County and around the state change each day. Forward progress can stop if we are not careful. The challenge of managing COVID-19 is a marathon, not a sprint. Very high-level anonymous cell phone data was recently published that clearly demonstrates, as time has gone on, more and more people across the country are moving around and mixing more and more. We must all be very careful at this next phase of reopening our economy, or the progress we have achieved together could be lost. The worst possible outcome would be for the virus to snap back and spread through community transmission. If the outbreak were severe enough, it could require reclosing businesses that are finally getting a chance to reopen. As we move into the next phase, we need to be adaptable and creative. Our new normal will look different than before COVID-19. Businesses will operate differently and we will shop differently. Our local businesses need our loyalty now more than ever. Local business owners are creatively responding to this new challenge with a spirit of innovation. It is up to each of us to support them and use our dollars here in our community. When the opportunity presents itself, please shop locally. I'm constantly impressed by the incredible new ways our community is spontaneously creating to serve our neighbors in need. Asher and Miles Sedlin, two teenage brothers in the Santa Barbara area, have created the 805 Homeless Helpers Initiative. This youth-led community effort is devoted to helping strengthen assistance for people experiencing homelessness. Recognizing the added challenges for people experiencing homelessness during this pandemic, the 805 Homeless Helpers Initiative has teamed up with Congregation B'nai B'rith to provide meals, supplies, and support to our homeless neighbors. So far, they've raised enough money to serve more than 300 meals in the community, in addition to picking up items for donation from community members throughout the South Coast. The Sedlin brothers remind us of the importance of helping the most vulnerable during this pandemic. To learn about how you can help this effort, please email 805homelesshelpers@gmail.com. That's 805homelesshelpers@gmail.com. Thank you, Asher and Miles, for your leadership and service. If you or someone you know are experiencing or at risk for homelessness, please call the Santa Barbara County Home for Good hotline at 805-450-3558. That's 805-450-3558. We'll now hear from Dr. Vonda Reynoso, the county's public health director.
Thank you, Supervisor Hart. Good afternoon. Today, we are reporting 69 new cases of COVID-19. 65 of these new cases are in persons incarcerated at the federal prison in Lompoc. Yesterday, we were saddened to report the 9th death in a person that tested positive for COVID-19. This person was in their 40s with underlying health conditions and was a resident of the region that includes the city of Santa Barbara and unincorporated area of Mission Canyon. We extend our deepest condolences to the family and the loved ones of this community member. Of the total 613 cases, 172 are persons incarcerated at the prison and 441 are community cases. Of our community cases, 355 people have fully recovered, 24 are recovering in a hospital with 10 of those in the ICU. 43 are recovering at home. Today, we see a significant rise in the number of confirmed cases, primarily due to the mass testing that began at the federal prison earlier this week. The federal prison in Lompoc is testing 100% of inmates to slow the transmission by identifying those asymptomatic or pre-symptomatic individuals who may be carrying the virus unknowingly and separating them from those who test negative, thus preventing those COVID-positive inmates from transmitting the virus to others. However, not all inmates who test positive are experiencing outward symptoms. While a number of inmates will test positive, a small percentage are experiencing acute or chronic illness, and the majority are presenting with mild or no symptoms. We are in communication with their infection control unit to offer support and guidance as they lead the effort to combat the outbreak on their grounds. The Public Health Department is reevaluating the way we present the data regarding the federal prison outbreak, as we will be receiving an influx of information now that mass testing has occurred. These changes will be shared in the coming days to provide our community with greater clarity regarding the prison outbreak. I'd like to update you on the testing in Santa Maria. So yesterday, we had our first day of state-sponsored community testing. Public Health and the Incident Management Assistance Team staff were on site to support OptumServe, the contracted vendor. 116 community members were tested, and the results are pending. We anticipate an increase in new cases with the increase in access to testing. Increased testing is part of the governor's strategy to reopen the state. Through increased testing, local communities can box in the spread of the virus by quickly identifying asymptomatic and symptomatic people who are infected with the virus, conduct contact tracing, and isolate exposed contacts to limit the spread of infection. In addition to the Santa Maria site, the Santa Barbara site at Earl Warren Showgrounds will be open tomorrow, and the Lompoc site at Anderson Recreation Center will be open on Friday. All sites are available for appointments. We encourage our community to take advantage of this local opportunity to be tested. This service is here to meet the need of every community member, regardless of the preferred language, immigration status, insurance status, or any other factor. These 3 testing sites are here for everyone. Screening and testing appointments can be made by visiting lhi.care/COVID testing or by calling 888-634-1123. The tests will be free of charge or billed to health insurance where available. Thank you.
Thank you, Dr. Reynoso. I've also invited Abe Powell, the Executive Director of the Santa Barbara Bucket Brigade, to join us today to share the new work of the Santa Barbara County Mask Network. The Santa Barbara Bucket Brigade formed as a volunteer community service in response to the tragic Montecito debris flow. Since the disaster, the Bucket Brigade has led a team of more than 3,000 community volunteers to prepare for and respond to natural disasters and community crises through volunteer training, coordination, and deployment. The Santa Barbara Mask Network is a natural step in the Bucket Brigade's work to prepare our community to be resilient in the face of the COVID-19 public health emergency. Thanks, Abe.
Thank you, Greg. Right now, we are in a community crisis of global proportions, and one of the keys to restarting society is getting masks on people. And we've started a mask-making mission. We call it Make Masks, Save Lives. On April 7th, we began making masks as a cooperative community effort. Since then, more than 400 people have joined us to participate in this program, making masks, delivering materials, packaging materials, and delivering finished masks to critical service workers. If you're a critical service worker and you need a mask now to do your job, you can sign up at our Bucket Brigade website. If you can sew, drive a car, screw in a light bulb, or work a phone, you can sign up to volunteer right now to help us make these masks and save more lives in Santa Barbara County. We are also making face shields. I have one here. We're making plastic face shields for doctors, for nurses, for first responders. If you have a 3D printer, you can sign up on our site. And if you want to help deliver materials, pick them up, or assemble them, you can also sign up to do that with the Bucket Brigade now. If you need face shields for your work, you can go to our website and sign up. All of these products are free to critical service workers who need them now. Ways you can help are many. The types of people that can help are just about everyone in this community, and we're looking for as many people as possible to step up now to help Santa Barbara County take the next step forward in this battle against COVID.
Thank you,
Greg.
Abe, and thank you to the Bucket Brigade and all the volunteers who are stepping up to fill this critical need that is in our community and also building community at the same time. We really appreciate the work you're doing.
It's a beautiful thing. Part of this started when my mother, who's older, told me that she was at home and she felt isolated and she felt worthless and she had no purpose and had nothing, no value to offer anybody. And I realized that she can sew really well. And we realized that by bringing in people who are isolated and feel like they have nothing they can contribute and bringing them in and giving them a way to help, that connects them to the whole community of helpers and to our cooperative mission of helping us fight COVID together.
Thank you again. Now we'll go to questions in the room. Ms. Lair?
Thank you so much. I'm with News Channel 3. Dr. Reynoso, can you comment on how you will pick who, if you sign up for those tests at those new locations, do you have to have symptoms to be first come, first serve?
It's complicated. So let me make sure I read the criteria for prioritization. So the order of priority is healthcare workers and those living in congregate living situations. Those who are symptomatic and are essential health workers or public safety or part of the infrastructure. Those with symptoms and older than 65 or with chronic medical conditions. However, we want to make sure that these tests are available to everyone. So it's a really low threshold. So even if you don't have symptoms, you can call and schedule an appointment and you will get fitted for an appointment. The testing sites will be open for the next 60 days, so you will get an appointment sooner than later.
And finally, at the supervisors meeting, you got some pushback yesterday about a graph focusing on the total number, but I do hear you at all these meetings talking about the number of people recovering, yet nationally, they're saying this is the #1 killer nationally. Do you foresee that happening in this county, is COVID-19 being the #1 killer? And what do you say to that pushback yesterday about the focus on the total number versus the recovered?
You know, I think that data is critical to share to all members of the community. So our method is always to present the total numbers. However, break down that total number of cases by active cases and fully recovered cases. I believe that that is a complete picture of the pandemic as it occurs in Santa Barbara County.
Thank you.
Are there any other questions in the room? Mr. Dreyfus?
Yeah. Are you concerned that we're going to open too soon, even if the governor gives us a go-ahead? I mean, we seem to hit a plateau, and then we're going back up again. So, I mean, if the governor on Friday says, let's open just certain things up, and, I mean, is the county of Santa Barbara looking at it like, well, we got to look at our own numbers first?
Well, the governor's process is first statewide. He has loosened the dimmer switch or opened the dimmer switch a very small amount to allow these relatively small number of businesses to open just for pickup. The guidelines that are going to be released hopefully tomorrow will explain a path forward that would allow local governments to perhaps open that more. We don't know that for certain. That is what he indicated on Monday, but we'll have to wait to see what the additional guidance is. But I know the governor is being very careful and looking at the data at a statewide level, and our public health department is also looking very critically and carefully at our local information, and we're going to be prudent and careful, but also provide the opportunity for businesses to get reopened in a safe manner. And that's the balance point that everybody's trying to hit.
And for businesses that are, a few of them closed already, but, I mean, is the county working with landlords or businesses to help keep them afloat? I know several businesses didn't get the loan from the government. So, I mean, State Street already has enough vacant spots, and to add more due to this, I mean, what is the county doing to help those businesses?
Well, as I mentioned today, I think this is up to each one of us in the county to take our local dollars and spend them locally. The businesses, as you mentioned, are suffering tremendously from the stay-at-home order, and this has been necessary to protect the public health of all the residents of Santa Barbara County and the state of California. But as we enter into this next phase, each of us is going to have a choice about how we spend our own dollars, and I hope that folks spend them locally. We need to protect our local businesses and invest in our own community. Any other questions in the room? Next, we'll go to questions on the phone.
Yes, first up we have Laura Place with Santa Maria Times.
Thank you. I was wondering if you all could describe a bit, just with Santa Barbara County's reopening plan that they're working on in alignment with the governor's plan, how Santa Barbara County is working with SLO County. I know that they're both working with REACH, the organization that helps just with business assistance and stuff like that, but just since SLO County is in a kind of a different place with their reopening plan than Santa Barbara County, like they already have theirs online for review and everything. Can you talk about how Santa Barbara County is navigating that relationship?
Well, the most important thing to recognize is that the governor's stay-at-home order controls the reopening of businesses. And as I mentioned previously, he has only begun to open the valve for some limited number of businesses to open. In parallel with that, we are working collaboratively with local business leaders, medical community, and others to develop a local plan that would give guidance to individual businesses as to how they could best operate safely and still stay in business, all within the governor's guidelines. But we don't actually have those guidelines physically until the governor releases them. So this is a dynamic process where we're trying to adapt to the changing direction from the state of California and to be ready here locally to open businesses as we're allowed to do that. So we're fortunate to have the work that the County of San Luis Obispo has done in advance. We are working in collaboration with the stakeholder group that they have used and the consultant that they used to develop that framework. We're using the same team of folks, so we have the advantage of their expertise and their experience that they've done in San Luis Obispo. We're going to apply that to Santa Barbara County, customize it, make it fit our interest and needs, and have input from our own local business sector about how it's appropriate for our county, all at the same time as being guided by the governor's guidance and trying to do this quickly and as fast as possible. So it's a challenge, but we are prepared for it, and we are executing it in real time.
Okay, thank you very much.
Those are all the questions we have on the phone.
All right, well, thank you. Today marks the first day of Nurses Appreciation Week. Nurses are at the forefront of a world health crisis, and they need our support now more than ever. Their skill and commitment during the coronavirus pandemic make a life-saving difference every day. To honor their work and the sacrifices nurses make every day, let's redouble our own commitment to keeping each other safe by continuing to follow these 3 simple steps. Number 1, please stay home as much as possible. When you go out, wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands for 20 seconds. Don't touch your face and disinfect surfaces. Number 3, if you feel sick, isolate yourself at home, call your medical doctor or clinic if your symptoms worsen, and follow their medical advice. Our next press conference is this Friday at 4:30 p.m. And if you have any other questions, again, please call the county's call center line at 855, or it's the 688-5551. The number will scroll on the screen after we conclude the press conference. Thank you for joining us today.